a lot of people have said that a lot of these changes that are occurring is kind of pushing us forward into the future, into changes that we would have made, but maybe have taken longer time to do. Hence my overcoming fear over my telehealth portal or developing a consent form for telehealth. These little changes, even as a professional, can be daunting. So there's plenty of resources out there now, and it feels like we're thrust forward. And when I get a call from a senior in a facility that knows they can reach me because they're isolated, I'm so thankful that Medicare has caught on and making it accessible, and how scary and vulnerable these populations are. So
And I
thank
think
you.
we can thank, the people when we think of advocacy, and this will foray us into more talking specific about the different kinds of advocacy. And
Hmm.
I'll share a story of my own personal tactical type of advocacy, but I think we can thank our state association, so the California Psychological Association, in particular the CEO Dr. Joe Linder Crow, and Elizabeth Winkleman, who is the um, you know who is also helps us with some of these. I'm going to forget her exact title, but she helps us with a lot of these things. They have been at the forefront, in terms of pushing, supporting what's going on.
I don't know her title, Amy, but I think that I think we should just put a like emoji of Elizabeth by like the bat phone. I
Yeah,
think
right.
that should be her title, because
That's
it's
right.
like she
That's
gets
right.
the calls for legal ethical advocacy. So most members
That,
out there are potential members. I mean, I just this month, my one key interaction with Sacramento was through Elizabeth, and she helped support about how to protect an adult and adult protective services and a conservancy type
yes,
discussion. So
yes.
anyway,
That
just had to throw that in there. Props to Elizabeth Winkleman.
Right, absolutely. She is both a psychologist and lawyer, and her title is Director of Professional Affairs, which I'm remembering now, but she's amazing. And both of them have been really great in communicating to members as well as to, the psychologists throughout California about these kind of wins. And then on the federal side as well, APA does a lot of work for us. So, and I think when we're talking, and also even earlier in the year, AB5 in California, in terms of
That's right.
allowing psychologists to keep their independent contractor status, and not have to follow some of the other laws that were going to be imposed. So that is, we were included with that, which was a win for sure. So, and usually when we're talking about advocacy, a lot of times we're talking about, people in their mind think legislative advocacy, right? You think about the laws and the regs, and how we make sure that, our profession is protected. And I think that is a very key type of, of advocacy for sure. And we want to make sure psychologists' interests are protected. And that's why we need our state association as well as our national association. But I think there are also other types of advocacy. So I'll let you,
Yeah.
I can talk more about those, but I think, I think as the Division One chair last year, one big kind of initiative of ours last year was to do a membership
That's exactly what I
study.
was going to ask you about. Like and that's a tremendous effort for any organization to look at, satisfaction internally, and if changes need to be made, what would they like to see, and who is our organization, and how do we not honor the people that we are the face of, but also bring in the needs of all of our members.
Definitely. And what we learned from the survey, we did some surveys, both quantitative and qualitative, and kind of did this study that was really, the entire year we did last year, and got the results from it. What we learned from both, these are people that are psychologists that are, and students of psychology, both members of CPA, both members of Division One, and people who are not members of CPA and are not members of Division One. And what we found was that actually, when people say they want advocacy, they actually mean lots of different things when they're saying that. Because the advocacy that we just talked about, legislative advocacy, that's one way that people kind of appreciate, work in that area. But there's also other kinds of advocacy that people are talking about. And so maybe it might be helpful just to share some of those different kinds of advocacy, and then I'll share a story from one specific type of advocacy.
Sounds great.
That has rang. So again, we'd already
We
talked
talk
about,
strategic.
Right. We talked to legislative, right? So
Hmm.
now in terms of strategic advocacy, that's kind of like advocacy that elevates the profession as a whole, right? And maybe even delineates the difference between what a psychologist does or who a psychologist is versus other mental health professionals. That's what we say, what we mean by strategic. And that's what we learned from our study, that that's what people appreciated, inroads in strategic advocacy, which is really how we delineate ourselves from other mental health professionals and elevates our profession as a whole. The other kind of advocacy is public mental health, and that's more, in the area of advocating for the mental health needs of California's.
The needs of homelessness.
Exactly. For our
Yeah.
population in whatever ways those are, right? In these different crises that we have. I mean, now with COVID and people being at home and not having access to services, whether that means, their usual, substance support groups, right? For like 12-step groups, or people's loneliness if they live alone, or domestic violence when they're stuck at home and they are in violent situations. So when we advocate for people, the public's mental health, that's kind of public health advocacy, right? Public mental health advocacy. And then the last one that we learned something about, that people really care about, that psychologists really care about, is more what we would call tactical or practical procedural kind of. I'm going to call it tactical for our purposes, but that's where, where you are doing something for that might be more specific, like insurance reimbursement, or that's more about it within the ins and outs of the profession, more things that we can advocate on behalf of, whether that's rights for psych assistance or hours or things like that that are important to us.